Because viscostat, astringent, and astringent X act so quickly to coagulate blood in the sulcus, they may prematurely tie up with blood-forming coagulum before reaching the capillary openings. Then, when the superficial coagulum is rinsed away, the cut surface will again begin to bleed. The Dento infuser was developed by Ultradent to permit the infusion of the hemostatic solution into the cut capillaries. The hemostatic solution is rubbed firmly against the bleeding, cut tissues until bleeding stops. The rubbing motion also wipes off excess coagulum, making it even with the cut tissue surface. Depending on the patient's periodontal and systemic health, hemostasis may be obtained in as little as 2 to 3 passes around the sulcus or up to as many as 20 or 30. Hemostasis is realized when the new coagulum stops forming. To test for completeness of hemostasis, the sulcus is cleaned with a firm air-water spray. Remember, if bleeding is the tissue's response to a firm air-water spray, then bleeding will probably also occur during placement of the impression material. Therefore, if bleeding occurs, more viscostat should be burnished firmly against the area. Once again, hemostasis is tested with a firm air-water spray. If no bleeding occurs, hemostasis has been achieved and we're ready to pack the cord. Ultradent's 100% cotton cords are knitted into long chains of microscopic interlocking loops. At first glance, these knitted cords may appear too large. However, the interthread space of the knit cord allows for easier compression and packing, and can carry a considerable quantity of hemostatic retraction solution in comparison with braided or twisted cords. Watch what happens when the ordinary braided cord is pushed down. It springs back up and returns to its original shape. But when the UltraPack cord is pressed down, it stays. UltraPack cords come in 6 convenient sizes. The cord size selected should be large enough to compensate for the compression of packing. However, tissue firmness and friability, as well as the amount of space desired, may require using different sizes. In general, knitted cords are most easily placed with a thin packing instrument. Ultradent offers serrated packers and the large and small slide packers. An UltraPack knitted cord is soaked in viscostat and then packed into place. After packing, rinse the area. The cords need to be left in place for only 1 to 3 minutes, rather than the customary 10 to 15 with other materials. Retraction is rapid because hemostasis has already been achieved. No blood is present to dilute the retraction agent in the cord. Remove the cord and once again clean the area and test for completeness of hemostasis with a firm air-water spray before the impression material is mixed.